We almost made it through another week, so thank you for jumping on. Let's see, there's about 21 people on. Should we wait a little longer or should we start?
Start.
Okay, I like that enthusiasm. So again, good afternoon. My name is Heather Gilbert and I am the Vice President of Marketing for PIK Wellness. And on the call, we have a few other celebrities, I'll say, in the healthcare arena. We have our program director, account manager, Brooke Lopiego on the call. We have our CEO as well, Rhonda Small. And we have the physician, software developer, guru, who is really responsible for bringing this all together, Dr. Cabrera, on the call as well. We are all available to answer any questions. And the purpose of today is to run you through a few slides of the program. And then Dr. Cabrera is actually going to walk you through the survey that's looking at symptoms, exposure, temperature logging, and then also show you some of the back end, the reporting and the dashboards that you have access to. If you have any questions, again, since it is kind of a large group, I would recommend that you put them in the chat, and Brooke will be monitoring the chat as well. So the first thing we're going to talk about is our program. It's called Prevention is Key. And the reason for Prevention is Key is that we want to get your employees to go back into the workplace in the most healthy, safe, sanitary environment. So we have developed this program called PIK Wellness, which stands for Prevention is Key. It's a 3-step program. The first one is that we're screening. The CDC is the authority that we're relying on that says you not only have to track temperatures, but you have to look at symptoms and exposure to be compliant with the CDC guidelines. So that is what this COVID check is doing. We're screening your employees to have a safe return to work. Step 2 is analyzing. And that's why I'm so glad to have Dr. Cabrera on the call, because he has created the algorithm that takes into account the CDC guidelines, looking at symptoms, exposures, and temperature to put your employees in one of 3 categories. Green, low risk, they're cleared to go to work. Yellow, moderate risk, they should contact employee health. Or red, high risk, they need to follow up with their doctor. If your employees get one of those yellow or red tags, then they will be blocked from going to work for 14 days. Now, that can be overturned should an employee have a COVID-19 test, should they have a visit with a telehealth or a physician. And then the goal is not to keep your employees from coming to work, but to make sure they're coming back to work and they're healthy. And then the last part is step 3, the reporting, where you can receive a real-time reporting dashboard of your employees that completed the survey, and then you can see aggregate reports as well. So this would be a login page, which Dr. Cabrera is going to walk you through. Your employees would log in with their email address and password. This would be customized with your name and logo. They have the different platforms to log into. The first one is the symptom checker, where they complete the survey. That's where they're looking at their symptoms, exposure, and temperature tracking. The next platform is the resources. There will be some generic resources in there, such as what is coronavirus. And then we can also upload any additional resources that you want in there that you want your employees to have. The next is case review, which has the option of having one of our nurses do a telehealth visit. And the last platform is telehealth with an existing provider through the county. These are some of the questions that you'll see with Dr. Cabrera when you go through the survey. We're finding out how you're feeling today. What is your temperature? We have the capability of uploading a picture real time of your temperature. Then we're going to look into exposure. Were you in contact with someone diagnosed with COVID? And then we're going to talk about some of the symptoms. First, life-threatening as well as less severe. So these your employees will look at. This is someone who's been cleared to go to work. They've completed the symptom checker. It will be date and time stamped so they can complete this prior to going to work if they want. The survey is valid for 2 hours, and then when they get to the work site, they can show this to security or HR to have access to go to work. This is someone in that intermediate risk. Maybe they have a moderate symptom. Maybe they're not feeling well. Maybe they've been in contact with someone who had COVID-19. They should possibly start home isolation, maybe get a COVID test, possibly have a telehealth visit or a physician visit. And this is someone who is having a life-threatening emergency. They may need to call 911. As Dr. Cabrera goes through the program, there's several factors that go into this algorithm, which places your employees in one of 3 categories: clear to go to work, that moderate risk, or that high risk. This is the option for the telehealth visit through the software application, where your employees can schedule a telehealth visit. They can select a date and time to have a nurse go over how they're feeling, what their medical history is, anything that concerns them. So that is available through the system. And you can see what a telehealth visit looks like. We also have nurse case management available. This is something that on our end, we can help direct your employees. Should they get that yellow and red, we want to send them a reminder. You need to follow up with your doctor. You need to schedule a telehealth visit. We can help order testing, on-site testing. So we're really an outreach for your employees that are in that intermediate or high risk category to make sure they get back on the right track and to go back to work. And it can be a resource for contact tracing as well. Again, Dr. Cabrera will go into some of the results and reports that are available. This is just one of the reports that you'll have access to that goes over the types of tests that can be ordered and what the results are in the aggregate. We do have a QR code for visitors. So if your employees have any visitors coming to see you, your visitors can scan this QR code and then they will be able to complete a survey. The survey will be very similar to what your employees complete. And then the nice piece of it is that 2 days after a visitor comes to the work site, they will receive a communication asking them how they're feeling. If that visitor is not feeling good, 2 days post-screening, the employee will be contacted that was visited by the visitor. So we're helping with that contact tracing inside the workforce. Again, some of the dashboards that we have available, it is real time when you log in to look at compliance by your employees, by department, as well as location, how many people have completed the survey, if your employees are low, moderate, or high risk, what the average temperatures are, and then compliance by the different departments and locations as well. Dr. Cabrera will walk us through this as well, but this is a snapshot where you will see your employees that day. The employee name, what risk they are, low, moderate, and high. If they've completed the survey today, real time. If they're in isolation, how many more days remain, their temperature, and the photo upload of the thermometer reading. This is that visitor dashboard that I spoke about with the QR code so that you can see who the visitor is, if they're at low, moderate, or high risk, and who they're visiting as well. So this is a dashboard that you also have access to. I spoke a little bit about the contact tracing, that with that visitor, once they make the visit with the employee, they will receive a follow-up within 2 days, seeing how they're feeling. And this talks a little bit about once the visitor arrives, they complete the survey, they have that meeting, and then again, we're checking up with them to see how they're feeling so that the employee can be notified if the visitor does not feel well. This is what your employees would receive as a welcome email. Again, we're going to customize it based on your needs and the language that you want, but the main message is to keep you and all of our employees safe. Every employee must be assessed for COVID-19 symptoms and exposure and temperature tracking. Of course, regardless of the survey results, if you have symptoms, you want to contact a healthcare professional. And then these are some of the options for the temperature upload. What's currently included in the program is the self-reporting, where the employee puts their temperature reading. It's on a scale. They can upload a picture of the thermometer. You may decide to do temperature checks on site. And we do also have the thermal measurements as well. So with that, Brooke, have you seen any questions in the chat?
No, not yet.
So I'm going to share with Dr. Cabrera.
Thank you, Heather. Good afternoon, everybody. Pleasure to virtually meet everyone. As Heather mentioned, if you have any questions, please send them through the chat and we'll address them as quickly as possible. I'm going to try to share my screen. Not quite yet, Heather.
Let's see. A co-host. You should be good to go.
Yes, perfect, thank you. Okay, so I wanted to give everybody the experience, first of all, what the employee is going to go through when they're completing the symptom checker every morning. So this application that we developed based on the CDC symptoms checking and exposure is a web-based application, meaning that there's no need for a software to be downloaded to a phone. You can access this as long as you have internet through a computer, a tablet, an iPad. You can do it through your phone, and all the information is sent in real time. We do have a couple other options. One of them is to complete this also over a dial-in phone number. That's one of the newest features. So we implemented that as a way to facilitate this and break down that technology barrier. If you do have any employees that might not have access to a smartphone or internet reliably, they can potentially call into a phone number, and that would automate the responses and still push them in real time through our platform. So this is the landing page. You're going to go in, and I'm going to give you the experience of the first time that a user, an employee specifically, logs in. They need to accept the terms of use conditions, go through the privacy policy and the consent as well, which is customizable per each company. So this just basically explains that, even though you're doing all your best to try to keep them safe, there's still potentially the risk of being exposed and coming in contact with COVID-19, so that they should always keep in mind that they need to practice social distancing and safe hygiene practices. And this tool by itself is not meant to keep everybody 100% free of the virus. So once they've gone through that and accepted, it takes them to their home screen, their landing page. So this is what we're seeing here as an employee. Now, the employee is going to get that message every morning that they have that survey pending and they need to complete it within 2 hours of their start time, right? So we're going to go through one version. This is the most common version we have of the symptom checker. We do have the flexibility of customizing the order of the questions and adding certain questions, which we've had to do that for certain companies where they had they had their own version of the symptom checker that they want applied here. But this stays very close to what CDC is currently asking. So the first question is very simple. I'm going to go through a scenario where an employee does not have any symptoms and they're completing this to go into work. So the first one is whether you're feeling ill today, yes or no. I'm not feeling ill. It's going to ask me about that self-reported temperature. And it's a simple slider where you can see it here in Fahrenheit or Celsius. So regardless of what kind of thermometer they might have at home, they can still use this and enter their temperature. The image validation is the ability to have the employee upload a picture, a real-time picture of that thermometer reading. We've had this request by some of the employer groups where they wanted an additional level of validation and not just the self-reported temperature. So with this, you're basically having the employees upload a real-time, it can't be a stored picture because it only opens up the camera to take a real-time photo, snapshot of that thermometer reading that goes along with the survey. It asks about contact in the previous 2 weeks with anybody diagnosed with COVID-19 and whether they've been working or volunteering in a facility or location that's known to be high risk, like it is a healthcare facility. So if you can see here, I've answered no to all the questions. My temperature is not above that of 100.4, and I'm going to submit. So the survey is going to take into consideration all those answers, temperature, and it's going to give them that clearance to work. Like Heather mentioned, you have that date and timestamp specifically to that employee, so you're able to verify that on the dashboard. And also, if you were using this as a secondary access control system, which some employers are, what they're having people do is kind of flash that screen as they're walking into work, and that's how they make sure that they were completed that survey that day and within the recommended time frame. So I'm going to go in right now a little bit into the administrator side of the dashboard so you can see how that looks, because I need to reset that survey. Any questions by any chance so far, Brooke?
No.
That's usually good. So let me dive in here into the administrator dashboard, which you saw a screenshot of it. But basically, you will have here the daily survey compliance. So based on your entire workforce, you can see how many have completed that questionnaire that day. And if you wanted to dig a little bit deeper and find out who has not done it yet, you can just simply click on the report and it brings up the names of the people that are still missing or they're still pending on that survey. And the same goes for if you wanted to see who the yeses were, and you can export this information as well if you needed to keep that on your database. You can see that risk stratification, whether it's low risk, moderate risk, or high risk, depending on how many symptoms they answered true to and how many risk factors they potentially had. This is the average temperature logs for the last 7 days. You're going to be seeing that information populate for your particular company. And based on location, you also see a similar compliance report of yeses and for completed surveys and non-completed surveys by the different locations or departments. So what I'm going to do here, this is the more in-depth and detailed report that as an HR administrator you would have access to, where you can see when the last completed survey was, if they were recommended to be in isolation, how many days are left in isolation for that person, what their temperature was, and if they submitted a picture, you can also come in here and see that image to validate that the reading goes according with the image you're seeing there. You also have the ability here to reset the survey. We've had a couple of requests where by mistake some employees might answer yes to a question that they were going through it too fast and it wasn't truly a yes. You would have the ability to reset their survey and allow them to retake it so they answer correctly and then get that clearance to come into work. If you wanted to send individual reminders, you were able to do that from this dashboard as well. Just clicking send, it submits a email to that individual. And if at any point you wanted to go in there and see what they answered to their latest survey, you would be able to just click on their view survey and look at the date and timestamp of when they completed that and what their answers and temperature was for that particular case. You touched a little bit on the nurse case review. Here you can follow up on those employees that were deemed moderate or high risk if they schedule an appointment with one of our nurses and what the status is, whether they're waiting for results or something else. And you can kind of track that in real time. Here is just general comments. It's not the full note that our nurses would put on the back end. That's really more for internal purposes. Here is just a general indication and comments of where they are, so you at least have an idea for that employee what the next step would be. So let me go in right now. I'm going to complete a survey with a couple of symptoms so you see what that not clear to work looks like. So this time I'm going to say that I am feeling ill. It breaks down a different set of questions right here, life-threatening symptoms. I don't have any of those, but let's say I do have a sore throat, a cough, no loss of taste or smell. I also started to develop these symptoms, let's say Monday, the 17th, no fever, no contact, and I don't have any of these chronic conditions. Not just for your knowledge here, these, the information that you're seeing here in those questions is something that is not shared at any given point with the HR administrator or employer in general. This is just used internally to identify if somebody we should put a little more urgency on them contacting their provider, because if you do have any of these conditions are considered comorbidities, you are at higher risk. So we can't just recommend you to sit there and wait and see if symptoms get worse, then contact your provider. If you do have any of these, the recommendation is within 24 hours, you should reach out and get seen and quickly tested. That's why we ask this as part of that CDC questionnaire, but it's not something that as an employer, they would have access to seeing that information. So I'm submitting that. It's going to take all those symptoms that we put into consideration to then provide me whether the clearance or in this case, prevent me from going into work. And because there were more than 2 symptoms in there, it puts me at that higher risk and it tells me that I should contact a provider within 24 hours. And not only does it do that, but also based on when symptoms started, it kind of calculates when or how many days are left in isolation for that individual. And this would be something that could potentially be modified by our nurses, or if you have somebody clinical on staff, they have access to a clinical dashboard where they can modify this, since the recommendation for isolation is very fluid right now with CDC. And if you were tested, it gets reduced to 10 days instead of 14 days. So that somebody with some clinical knowledge will have control and be able to modify that accordingly up to the most recent guidelines and recommendations. Resources here, as were mentioned, we have information on how to stay safe based on CDC. So it's always kept up to date. Some additional resources there for your employees. If they were to go in and required to be seen by a nurse, they would be able to come in here and schedule a visit by selecting the date, the time, and just putting in their information. One of our nurses would be able to give them a call and go through a secondary assessment and then give them additional guidelines and recommendations. If they need tested, we can go with information that you currently have. If not, they have resources on where to easily find a testing center to be able to get tested. And as Heather mentioned, telehealth, we work with whatever the provider is for your group. So if you already have a vendor, we just put it in their information, a link to their website here. So we make it simple for your employees to be able to access and find that information and have a telehealth consultation. let me go quickly here into the clinical staff side. So this provides a little bit more control over if you do have somebody clinical on your staff and they wanted to be able to reduce the isolation period, they would be able to go in here and modify the temperature, make updates to the temperature, or modify isolation. So you can also look at the testing that's being performed. If you are having your employees get tested and they provide you with the documentation, this would be a good place where you can go in and start entering that information. So it's always kept on your dashboard and you can easily see and identify that in an aggregate reporting like you have it here for either PCR, antibody, or antigen results. If you are opting in for nurse case review service and our nurses get that information, they would go in there and enter that information in the platform as well, that report. And once it's added there, you can see that, for example, for this employee, we added some fake testing data there, and you'll see when the test was, what kind of test, results, and a report from the lab of that as well. So all that information is kept on that dashboard for future reference, date and time stamped. And the last thing for visitors, as Heather was mentioning, we have a very simple system that's based on a QR code where you could place these, print the PDFs out and place them all over your locations. And if somebody does come in to see that, we would be able to show you that that QR code. And in that case, you would be able to have those visitors complete a similar version of the symptom checker. And we would collect their name, their email, their phone number. So that way you have that as a reference. If they do answer that they potentially presented some sort of symptoms, 48 hours after their visit, you can call back and make sure if they get tested what the result was, so you can inform and plan accordingly based on whoever they were in contact with in your facility. So any questions there? I went really fast through this, but I wanted to show, all the features it has, and we'd like to think that it's very straightforward, that once you're in there as an administrator, you can kind of just see the information and be able to navigate and go through this really quickly. There is one new feature that we are finalizing adding, and it's a lower level access to not necessarily the HR administrator, but supervisors, where as a supervisor, you would get a daily report of your direct reports. You would be able to go in and see who completed the survey, who has not done it yet, send them reminders, reset surveys, but you're not going to be able to actually see the results of the survey. So you can only see whether somebody has completed it or not. If somebody claims that they made a mistake, you could reset their survey. You can send them a reminder, but you would not be able to actually see the information that was reported. So that's the access between that employee and that HR administrator. HR administrators do have access to see the results, temperature, all of that. Supervisors can only see status of pending or clear to work, not clear to work. Okay. Heather, anything else that I might have?
Well, I think it's important to note that this is in several languages, so that.
That's a great point, and you can see that. Thanks, Rhonda, for reminding me of that. You can see that on the top right corner that it's an easy drop-down box here, where you can just go down and just choose your language. Let's go with Russian there. And it changes the entire platform, the symptom checker, everything to that new language you selected. The information you're receiving on the back end, even if somebody completes this in a different language, you're still going to be seeing everything in English. It's just the user that's seeing, their questions and their profile on that other language, but you're getting all the information back in English.
And I think the other option that you may want to think about, which was the original version of the software, was especially because you're in Arizona, because you're in a hot spot with high incidence of disease, to actually ask all those symptoms. lot of times you'll just ask, well, how are you feeling? Well, I'm feeling fine. But if someone actually asks you, well, do you have a sore throat? Do you have chills? Do you have this and that? Some of those symptoms they may not think about that they have. And when they're actually questioned about it, they may say, well, actually, I do have a sore throat, or actually, I have been feeling really tired. I had, so especially in areas, is Arizona, I'm in Florida in a hot spot. So there is such a high incident that that version's also available. Am I right, doctor?
That is correct. We have a couple of different versions of the questionnaire. And as part of the implementation, we would be able to go through those and see which one fits best. Some internal protocols, policies you might have already written. We definitely showed you the live version with the simple questions, but we've gotten this with some clients up to 15 questions every single time. And that's just based on their particular needs and their policies. And we're very flexible with that. Absolutely.
So there was one question in the chat was if the presentation is going to be recorded, and we have recorded it, and then we'll make sure to get that out to everyone. Additionally, it's not over after today. We are here to handhold you through this entire process. We want to make it a success. We have 24/7 customer service, a call center. You will have direct access to our teams as well. We're here, we have manuals and program guides, and this is just the first of a few calls to really get you up and running and to understand the system. So we are gonna handhold you along the way to make sure that you're comfortable, you know your capabilities, you can resubmit a survey, and to make sure that you understand the reports and the dashboard.
That is correct. You mentioned it. There's a lot of guides and quick navigation guides. Part of the process, if there's the need to have some demo accounts created to have some people go in and start getting more familiar with this before launch, we offer that as well. So you can get an opportunity to get early on to the tool. We like to usually do a soft launch first with people that are going to be helping others, those super users. So we'd like to include them and give them a couple of days with the tool so they can get their hands on it and maybe identify any potential barriers or questions that we haven't thought before we actually launch this with the entire population. So that's usually how we like to roll things out. Once we have those implementation calls, we do a soft launch with the group that's on the call, and then we get some additional feedback before we finally roll it out with the entire workforce.
So if there are no other questions, I have left Brooke's email in the chat. It's brooke@pikwellness.com. Feel free to reach out to her, and we will also be sending you the video presentation, and we look forward to the next steps. Okay, everybody be well. Thank you.